The opinions and statements made by the guests of the Success in Practice podcast are their own, and I do not endorse or accept responsibility for their positions. Any information given by myself or the guests is educational in intention and not to be taken as medical advice. If you choose to act on the content involved in the podcast, you do so at your own risk. Welcome back, everyone, to another episode of the Success in Practice podcast. Today is a special episode. This episode I'm actually conducting with one of the nominees for the Osteopathy Australia Board of Directors, Tayla Lane. And so it's a good opportunity to speak to Tayla and find out why she feels that she'd be a great candidate to sit on the board of Osteopathy Australia. I've put the call out to all the nominees to come onto the podcast and have a chat and give us a little bit of insight about their particular story and why they feel that they could contribute very well to the board and to Osteopathy Australia. And so let me introduce Tayla. I'm joined today by Tayla Lane. Tayla graduated with her Masters of Osteopathic Medicine in 2022 from Southern Cross University. For the past few years, Tayla has been working in Central West New South Wales, where she is currently still working part-time. Tayla has an interest in women's and children's health, guiding and supporting women through their pregnancy and postpartum journeys, as well as pediatrics with birth strains, growth and development. She also enjoys working alongside individuals with sports injuries, job-specific restrictions, and chronic pain. Tayla travelled to the UK in 2023 to co-present her master's research at the International Osteopathic Conference. She has been nominated for the director position on the Osteopathy Board of Australia, or the Board of Osteopathy Australia, I should say, to collaborate with a team and to be a voice for the members of the Osteopathy Australia community. Her drive to educate the public on the benefits of osteopathy and its importance in healthcare is a significant motivating factor for her nomination. Increasing public and broader healthcare system recognition of osteopathy is a passion of hers and a key reason she pursued a career in allied healthcare. Serving on the board of Osteopathy Australia is a vital responsibility in representing and protecting the interests of osteopathic practitioners while promoting best practices. With the criteria outlined by the board for the director position, she can effectively represent and advocate for a particular demographic of the osteopathic practitioner community. Being based in a rural region, both as a new graduate and having grown up in a similar setting, has given her valuable insight into the public's reliance on allied healthcare services and the increasing demand for improved services, resources, and access. She's eager to collaborate with fellow board members to influence and advance strategies that will ensure a vibrant and sustainable future for our profession. Her goal is to contribute to shaping policies that support osteopaths and enhance patient care across Australia. In her spare time, Tayla loves going to the beach, surfing, reading, and being out on the farm with her horses. Tayla, thank you so much for joining me. I know it's been short notice, but as these things always happen, the nominations come in and then obviously I think the nominations committee have a look at your particular nomination and decide whether you're eligible to run for the board position. And as soon as that eligibility was, made public, I got in contact and sought, having you here on the podcast. So thank you for doing this at such short notice.
Thanks for having me and giving me the opportunity to have a talk.
That's okay. Always a pleasure. Like with everyone, I'd like to get a bit about your backstory and early influences. So tell us a bit about you, Tayla. Tell us where you grew up. Tell us about your early education and also your osteopathic education.
Yeah, so I grew up out in regional rural Central West, I guess, in a town called Orange, or we lived on a property just out of Orange.
That's in New South Wales.
In New South Wales, yes.
Yep.
I've since gone back as a new grad, and it's definitely grown a lot since I was there as a kid. But yeah, I grew up riding horses and living on the farm. Went to school in town, so on the bus a lot. But I guess my early influences was my mum was very much into healthcare, especially alternate and complementary healthcare. As a baby, I had a lot of eczema, so she was trying to seek a lot of products that were, I guess, non-toxic and things like that. So I had a big influence of complementary healthcare as a kid, and then growing up. And then, yeah, for work experience, my PDHP teacher, after doing an anatomy subject, said, go check this gentleman out. And he was like, I guess the old school, someone come in, massage, and he'd come in and adjust. And I followed him with his human clinic as well as his horse and greyhound clinic.
Who was that, Tayla?
Gary Christo, his name is.
Right. Shout out to Gary.
Yeah. And then I started doing sports science because I was still really interested in rehab and pain management and things like that. And then my partner happened to go to some other osteopaths in town. The clinic I ended up working at as I came out as a new grad, and I saw their style and their approach, and I think that just reignited it again. And I decided to swap degrees pretty much after observing them in my sports science university observations.
Right.
So I signed up to Southern Cross.
So you went to university and did sports science first,
as a start,
and then you transferred from sports science over to osteopathy up at Southern Cross. How many years of sports science did you do before you did that, Tayla?
I got 6 months in, and then I met these guys and went, yep, that's right, that's where I was meant to go. So, yeah.
Yeah, right. Okay. All right. So I guess then you graduated, what year did you graduate, in 2022?
Beginning of 2022, yeah.
Right. And so you went into rural practice straight away?
Yes. Yep. First year out.
Okay. And what are you doing at the moment? Where are you practicing at the moment? What's your current situation?
Currently working in North Ryde in Sydney, New South Wales, and I periodically go out to Orange and see some regular patients.
North Ryde. Geez, there's that. What's his name? That tall bloke with the red hair.
Kevin. Kevin Finnan.
Kevin, that's it. Kevin Finnan.
Yeah. Yeah. So I'm part of his team, which is really cool. So,
and the freckles. Don't forget the freckles.
Yes, that's it. Yeah. We've got red-haired and freckles in common, so I've always hit that off well.
Shout out to Kevin. G'day, Kevin.
Right. So, yeah.
Right. So you're working there, and you're also still working regionally. Is that correct?
Yes, I've been heading out to Orange periodically as I can to see regulars for generally a day or two.
And how have you found that? Like, when you say periodically, are you going out there once a month?
Yeah, sorry. At the moment, once a month. Last year, I did 3 days in Orange, 2 days in Sydney. So I kind of had slowly backed off the time in the car traveling back and forth.
Yeah.
So yeah. Once a month.
How do you find that, Tayla? Like, how do you did you get a pretty full list on the days that you're out? Do you just go do 1 day every month? How does it work?
At the moment, 1 day every month, and generally it's booked 9 to 5.
Yeah, and you're pretty booked out. Like, you're just rebooking patients as you see them month to month. You're just seeing.
If anyone calls up the clinic in the meantime and wants something and there's an availability with me, they'll pop. Especially if I've seen them before. There's a lot of, patient sharing in that sense because of availability. So you might see people randomly, then they'll see someone else for a bit, then they'll come back. Right. So if there's a spot with me and they want to happy to see me, they'll pop them in.
Right. And it's pretty busy for you every month that you go?
Yeah, definitely. I think, booked out 9 to 5, so keeps me on my toes.
Fantastic. All right. Well, thanks for giving us a bit of backstory about you. Let's get into the nitty-gritty of why we're having this discussion tonight. So you how did you get about, or what attracted you to run for a board position? Like, what was the attraction of doing that? What made you go, yes, that's for me?
Well, I guess Kevin highlighted it for me and said, have you seen this? And I had a look into it and just thought, I'd really like the opportunity to bring a new grad perspective, I guess, perspective of someone, as well as a lot of other new grad osteopaths who went through it during COVID. So coming out as a new grad with clinical experience, that was potentially a little bit different because of, lack of patient numbers in student clinics and things like that, as well as, I guess, my lived experience of having endometriosis, I thought, I've been seeing a lot of really great CPD and courses that have been coming up with other osteopaths and other healthcare practitioners in terms of endometriosis and pelvic pain. And I thought, well, give this a go and go to the board and take that passion that I have for osteopathy and championing that in the healthcare community and see how it
Right.
goes.
Okay. And to get on the board, I think, there's got to be a nominations process.
Yep.
How were you? Did someone nominate you? Did you, who nominated you to get up on the board?
I had Kevin nominate me as
Right.
one, and
Yeah.
then I had one of my colleagues out from Orange, Simon Chambers, as the second.
Fantastic, fantastic. Okay, so
Yeah.
given the fact that you, I guess, want to represent a new grad perspective,
hmm
and maybe or definitely a rural perspective, let's break those down and have a chat about them. Tell us about the new grad perspective. What is the new grad perspective that you want to bring to the board?
I guess just that accomplishment feeling as you're developing your clinical skills was something that I found was very strong. I think I went into a new grad in my new grad year quite anxious and concerned about not concerned about my skills, I guess, but just knowing how to handle everything. Being probably a bit more of a anxious person in general, so I really wanted to just, if anyone feels that way going into new grad years and handling cases, especially any complicated or acute cases, just bring in that perspective of I guess, support.
Right. So you want to try to advocate for support, more support for new grads who might feel anxious about their first couple of years of practice,
Yeah,
especially because there were those COVID years where students didn't get the clinical, I guess, touch point with patients. Do you feel that that's something that would that clear up your position there? Are you trying to support that particular
yeah,
demographic?
yeah. That's probably a nice way, nice, neat way of saying it. Yeah,
Right.
definitely. Just I guess the lack of contact
Yeah.
of patients in the student years or
Right.
student clinic was something that I felt was, even though the
Okay.
uni tried really hard.
Yeah, definitely. So, what do you have any ideas about how we can support or how the profession can support, especially, I'm going to narrow it down for you so you can give us a specific answer, especially
hmm
that cohort of students that graduated during COVID, that had to do their clinical experience during COVID, that didn't have the contact hours. Do you have any
Yeah.
ideas of how they can be better supported? Do you have anything that we want to bring to the board and say, hey, I've got this idea of how we can support these new grads. Do you have something like that you want to share with everybody?
I guess tutorials and mentoring a bit more.
Hmm.
I know lots of new grads do go into clinics with other osteopaths, but I know there's a lot that don't always, that if they're in a busy clinic or they've gone out on their own, they don't always have that mentoring. So I guess bringing forward maybe the idea of tutorials and mentoring through the new grad years or even just the first year in building
Yeah.
that confidence in clinical skills and palpation skills even.
Yeah, right. Okay, let's move on to the rural aspect of things.
Sure.
You grew up rural.
Yep.
Sounds like you're a country girl, and so tell us about the rural perspective. Like, what is it? What's different about practicing in a rural setting versus, say, more of a metro setting?
The amount of osteopaths or osteopathic practitioners, I would say. In Orange, I worked alongside four others, and I know in Bathurst there was a couple of osteopaths as well, but we would have people travel up to 2-3 hours for treatment. Generally, that was alongside a specialist or a doctor's appointment or anything like that. But I think
Mm.
just the amount of practitioners out that way is hard to come by.
Right. So what you're saying is that we need more practitioners. Need more access to practitioners wanting to go rural.
That
Yeah.
would that would be ideal, I guess. Yeah.
Right. Okay. And again, I'll put the same question to you. Do you have any ideas
Yep.
about how that could be improved, or how the association, or I should say Osteopathy Australia, could help
Yep.
maybe in that regard?
It is a hard one. I think a lot of people try and stay where their families are. So if they don't have family rurally, it can be
Mm.
hard. I do know that Charles Sturt, with the medical students, do grants and incentives to have them at least do some new grad years or registrar years out there. So if there was something similar maybe for osteopaths,
Mm.
that would be great. But I know it is a hard one to navigate with people wanting to stay probably close to family or where they grew up or anything like that.
Yeah. Well, I guess the Victorian experience has probably given us some ideas in that, when they've got two universities pumping out students, it makes it a little bit easier to spread out
Yeah,
the osteopath. So definitely, I think having a couple of courses, New South Wales can handle, I think, at least two osteopathy courses quite well. And so I
yeah,
think advocacy for new courses in New South Wales will really help that particular part of the country. Um,
definitely.
right, Taylor, I want to move on to the next question, and
Hmm.
I guess it's something that I guess we need to ask you, especially as a young practitioner, early career osteopath.
Yeah.
Given your kind of relatively new experience as an osteopath, um, what qualities do you have that would make you the best candidate for this particular role?
I think going back to the 2019, bit of resilience, which I'm sure we all have, but just trying to go through clinical practice with potentially less numbers, people holding back, I guess, financially a little bit, decreases number of hands on.
Mm,
Um, I guess, as I said before, building confidence and skills clinically. You can show what we kind of need as new grads coming out in those years of support as we do develop those skills to potentially, 50 out or something like that, where you start to feel a bit more on not on the ball, but just maybe potentially a little bit more confident with cases or your skills or patient management, patient support, anything like that.
mm. Given that obviously you would come in, if you were to be elected, you'd come onto the board as the newest member of the board,
Mm-hmm.
with a I guess an executive there that's been there for a fairly long time. Are you
Yep.
confident that you can get your message across? Like, are you confident that you can sit there amongst other practitioners who are maybe 10, 15 plus years experience, and also, like I said, an executive that's been there for many, many years? And if you have an idea, are you confident that you'll be able to get that idea across and maybe have some things get done?
Yeah, I believe I'd be confident in doing that. I think that my passion for osteopathy definitely gives me the confidence to feel like I can get my message across
Mm.
and some ideas across.
Yeah, I think the key thing, I think, for listeners especially as well as myself, is that we definitely, I'm a member of Osteopathy Australia, and we definitely want somebody there that
Yeah.
is going to not just be there for the experience.
Mm.
Although it is a great experience, we want somebody to be there that actually will have ideas and get things done, and actually be able to achieve maybe a certain goal that they've set out to achieve. So we definitely want that,
Yeah,
and we hope that whoever gets on there would have the confidence to kind of put their best foot forward, I guess. All
definitely.
right. What is it that you feel needs addressing, I guess, for rural osteopaths? Like, if you were there, I mean, let's say you get elected, you go into that first meeting, Taylor, or second meeting, or whatever it is that you might be doing. Where would you start? Where do you feel, what's the first thing you would say to that board and saying, look, we need to help in this way? Let's start with rural osteopathy. What would be your first order of business?
I think I'd want to be starting advocating for the knowledge of what osteopaths do and the benefit of osteopathy. Finding that out there, well, this is just my experience. It could be different elsewhere, but the knowledge of what osteopaths do and the benefits in healthcare is hard. Getting that across to GPs and supportive other practitioners in a multidisciplinary approach to things, noticing that as I was building and obviously being in a clinic that was clearly quite established, there's relationships with midwives and lactation consultants, which was really, really lovely. But in terms of, maybe potentially talking to doctors or GPs, where it was a bit lacking, I guess. So I'd
Mm.
be wanting to start pushing for advocating for that more as the awareness of osteopathy in rural areas and what we do.
Right. So, would that include just better defining what it is that we do as osteopaths?
Yeah, and it potentially as well, just engaging with key stakeholders or government people in that run GP clinics and doctors clinics out there is the information sessions
Yeah,
as well.
yeah.
Presentations on this is osteopathy, this is what we can provide,
Mm.
and really building those relationships out
Do
there
you
a bit more.
find that there's a, like there are, I guess, gatekeepers? Do you find that the GPs and the medical professionals rurally more so than in the metro areas, do you find that they are more like gatekeepers of people's health there? Like, do you need to get, would accessing GP clinics and medical clinics be a good pathway to say, seeing more patients in rural areas?
Not necessarily. I think once you've developed a relationship with a lot of GPs and a lot of medical staff out there, they're actually quite open to working alongside you. I think it's just the awareness of what we do more so than anything else.
Yeah.
Or that's what I found in my experience out there. And potentially it's because I was in an established clinic that's been there for many, many years that there was relationships already being built.
Mhm.
But yeah, I would say it's more just knowing what we do and what we can bring to healthcare. That was probably the biggest thing.
All right, let me ask you the same question as it regards, I guess, new graduates, and especially the graduates that graduated through the COVID years. You've
Mm-hmm.
already touched on what you would do in terms of tutorials and more mentoring.
Yep.
What's the first order of business there? Like, what is it that you would want to implement straight away, or at least push an idea? What would be the first thing that you'd want to do regarding new graduate or early career osteopaths?
That's a good question. I guess wanting to, with the CPD, I know there's a lot of mandatory stuff that we have to do. And I know when I came out, there was also stuff, resources for the new grad or first year. So adding a bit more into that in terms of potentially key topics, communication, rapport building, all those kinds of things. Potentially
Mm.
just aiming for more resources and adding, especially for that CPD, for new grads.
Do you feel there's a role there for the association to maybe have some better input or better communication with the universities themselves in terms of, like, one of the critiques that I've made is that we hear about Osteopathy Australia going out to the universities and meeting the fourth years and the fifth years, and that's great, but I think what we don't want is them going out there and just giving them a pat on the back and saying, everything's fantastic, everything's going great. Obviously, there's some gaps in education that need addressing. Would you be an advocate for being a bit more, I guess, frank with universities in terms of what the profession expects in terms of quality of graduates? Like, are you somebody that would like to sit down with university and say, look, we really appreciate what you're doing. We'd like to
Mm-hmm.
see, this, and that, maybe done a little bit better.
Yeah, I think that would be something I'd be really keen to be a part of. Going through uni, my master's degree, we did a research project, and within that, it was talking to osteopaths with experience with pediatrics, and a big key theme was that they just thought there was lack of knowledge for new grads coming out to treat pediatrics. So that's coming back to, I guess, education and criteria within the university. So definitely something keen I'd be keen to
Mm.
sit down and talk to them about. Yeah.
Yeah, I remember myself as a university student, and very often, almost like at least for 3 or 4 weekends every semester, we would have osteopaths, very experienced osteopaths, come out and teach us over the weekends. And when I say teach,
Wow.
just have a chat to us, do lots of hands-on stuff, run tutorials, and that was just done out of their own volunteer work. And
Yeah.
I think that's something that the association can do, can fill a gap there in talking to the universities and say, hey, what if we organise a couple of the osteopaths to come in on weekends, do some tutorials with your students, fill in some gaps in real world private practice, and maybe you can help us, give us a space, give us some beds, and organise the students to get out there. I think there could be some That's definitely something that can be done straight away. And obviously, there would be some
Yeah.
regulatory or some red tape that you'd have to get through. But given that the university wants that, and given that the association is keen to do something like that, I think that's a very good place to start. And just
Yeah,
getting
definitely.
getting osteopaths there on weekends and doing courses. I just did a course with Lisa De Stefano down in Melbourne a couple of months ago, and I was talking to the organizer of that course, and I said, "Why isn't Lisa being invited to Victoria University or RMIT, to do this? Why is it that we have to, you know, um, do this privately? It should be something that we really advocate to have people who have lived experience in osteopathy come out and teach our university students. I think
Mm,
is a place that can be really it's something that can be done straight away. But
definitely.
yeah. Anyway, all right. Let me then ask you. Let me ask you something specific about Osteopathy Australia.
Hmm.
What do you currently know about Osteopathy Australia? Maybe a little. Do you know anything about its history and maybe its role? Like, what's the what do you see as its main role as an association?
I think the main role is championing osteopathy in and in developing, will continue to develop it and grow it as a profession. Upholding professional and ethical standards is a big thing, and trying to engage in research and developing that evidence based practice. And then making sure that all osteopaths, all members are feeling in a community and accepted and like their voices are being heard.
Right. Um, do you think it has a role in, I guess, maybe bringing some unity to the profession and really understanding or having a position on what it is that osteopaths do? I mean, I
Yeah,
haven't heard it. Yeah.
yeah,
Maybe like a position statement or something on osteopathy. This is what osteopathy is. This is what osteopaths do. Um, and that way we can kind of work out from there. But it should be something that really unifies the profession.
yeah,
Um,
definitely.
yeah. All right. Then, given that, do you feel like that? I mean, uh, given that you believe that it's, I guess, there to champion osteopathy and drive forward some of the professional standards, and also, uh, I think you said uphold the professional standards and build a research base for osteopathy.
Yeah.
What is it that you think could be done, say, in the next couple of years in terms of improving that research base? Do you have any ideas on that?
I think, well, giving the opportunity for more research grants and access to doing research in the osteopathic profession, whether that comes from the master's degrees and really pushing for that kind of evidence to be um, not necessarily published, but put out there, as well as grants and mentoring through research projects, collaborating with other osteopaths and other professions as well, for that multidisciplinary approach. I think is a big thing and
Yeah,
something that we want to keep developing.
you're right. I think the osteopaths require mentoring in a clinical setting, but I think they also require mentoring in a research setting too.
Yeah,
So maybe getting osteopaths who have ideas about research and putting them in touch with other people who have the know-how on the process of research is a good thing.
yeah.
So yeah, definitely that's a good point that you make there. All right, is there a key issue at the moment that you feel hasn't been addressed by Osteopathy Australia that you'd like to see addressed by Osteopathy Australia? Is there something that you feels, you kind of look at it and go, I wonder why they're not doing this, and really like to make that point. So, is there anything that you want to tell us about there?
Not necessarily that I can think of from my experience so far. I think the kind of points that we've really touched on in terms of, rural based osteopaths and the demand out that way, and then
Mm,
building mentoring and research for osteopaths, and then the mentoring for the new grads. I think that's just something that I'd really like to see building. And then, as we discussed earlier, I've seen some really lovely and great courses and information starting to come out more about osteopathy and women's health and pediatrics and things like that. And I think that's something we can definitely address and keep pushing for the knowledge and engagement and awareness of what we can bring for those groups as well.
Mm. I guess if elected, where do you see yourself fitting in? Like in terms of what would you enjoy being a part of? I know they have education committees, there's nominations committees, there's I think committees for the advanced accreditation and so forth. There's research committees. Where do you see yourself fitting in amongst the board, and where would you like to, I guess, apply your skill set?
I think research and education is probably a big one. I'm big on my always developing and expanding knowledge. So I think being a part of that, I find that quite engaging. As I said before, the research stuff is something I'm pretty keen to push for osteo in general, for that evidence-based practice. But
Hmm.
even that developing, professional development and CPD stuff would be really good, just to see where there's potentially factors that need a little bit more, or there's access to resources that practitioners might think, oh, I'd really like to engage in that subject, or I had a patient come in and I really want to learn a bit more about that particular case or presentation. So I think they would be the factors I'd really like to fit into and engage with within the board.
Yeah. Given that one of your roles as a board member would be to, I guess, oversee the executive function of Osteopathy Australia in terms of how it functions and the employees, I guess, of Osteopathy Australia,
Mm-hmm.
what standards would you see yourself? I guess, I mean, like, you know, I mean, yeah, I'm trying to put this in a way that makes sense.
That's okay.
Um, I guess looking at yourself um, as somebody who's a board member who's responsible even financially. As I mean, when you become a board member, you're actually responsible for the financials of the board.
Mm-hmm.
And the board has, or the board, but the association has employees under its purview.
Yeah.
How do you assess their particular? How would you go about assessing their particular performance? Like, how do we make sure that the executive is actually performing its duties to the best of its abilities?
I guess feedback from members would be a big thing, as if they feel things have
Mm,
been engaged. Feedback from those employees and how they feel they're being supported and their roles, if they feel like they're hitting those targets that their role involves.
mm.
So that's a good question, that one.
Yeah.
I guess
Well, it's an
biggest
important
thing is
one. Yeah, it's an important one because I mean,
absolutely,
it's one of the main functions of a board is to oversee the executive and oversee the people who work there. I mean, the board kind of takes decisions, and then the
yeah,
executive is there to implement the decisions and kind of because at the end of the day, the board is a representation of the profession. The executive is not a representation of the profession, and so we have to make sure that we make sure, I guess, that all the employees of Osteopathy Australia are doing their job to the best standards possible, and that we hold them accountable for that, right? And
yeah,
we give them a pat
absolutely,
on the back when they're doing a great job, and we hopefully, I guess, constructively understand when they're not doing such a great job, and be prepared to take action on that. Um, that leads me, I guess, to my next question. And you mentioned that about kind of getting feedback from members, and that's a really good point that you made. I really appreciate that you said that.
yeah,
Um, and so, what I want to ask you is that I've had a look at I guess, the financials of Osteopathy Australia over the many years since COVID, and there seems to be a drop off in membership of about, I think there was about a 25% drop, roughly in membership, and that's a significant drop post COVID.
mm,
Whether it's due to, I guess, people's financial restrictions during and post COVID.
yeah,
I know that there's been some feedback regarding the position of Osteopathy Australia, regarding, I guess, the way things were operated on during the COVID, during the pandemic, their position on vaccine mandates and so forth. Um, uh, I don't want to kind of go into that in that
Hmm.
sense, but I do want to ask you, is that those people that have kind of left the association, um, I think, how would you get them back in? We want everyone to be part of the association, right? Like we
Yeah.
do want we'd love every osteopath to be part of the association. Who wouldn't? Because
Yeah.
I think the broader the representation, the better the profession. So how would you re-engage people, whether they've left for financial reasons, whether they feel like the association doesn't give them value anymore, whether they feel like something happened that they weren't happy about? How would you go about re-engaging those people and getting them back under the Osteopathy Australia banner?
I guess, yeah, speaking to them as to why they left, and try and advocate for the reason that they left, I guess, make them feel supported as best as possible,
Mm,
in the reason. Obviously, there's lots of broad categories or factors that people have
mm,
left, and you can try your best to try and tick all those boxes.
mm.
But I guess just engaging with them and making sure that they feel heard, and bringing that forward to the other members, and seeing what we can do, would be a big thing. I guess advocating whether that, I know Osteo Australia already does, like, quarterly payment plans and things like that. If there's another way we
Hmm.
can engage, potentially financially, ethically, and I guess with the COVID vaccines, that's a hard one.
Yeah,
Um,
it's not so much, the question isn't so much around whether you support that or whether you don't support that.
yeah,
It's
yeah,
more so that if people felt like that the association didn't represent them at that time,
yeah,
that's done. It's in the past. I think it needs to stay in the past.
mm,
But moving forward, how do we go about re-engaging those people? I mean, we need to hear them out there. I always feel like Osteopathy Australia is there to represent its members, but it's actually there to hopefully represent the entire profession, members and non-members,
yeah.
because every non-member is a potential member.
That's it,
You
exactly. And an
know,
osteopath that warrant support and communication and respect
yeah,
within their profession. So definitely, I
yeah,
guess, just reaching out and engaging them, and supporting them as best as possible, and championing them within the board to say, this is a factor that we need to work on.
yeah, and hopefully, I guess if there's errors in what we did in the past, and we can kind of account for that, and then we can do better moving forward.
Exactly.
I think that that's something that people are always interested in hearing,
Yeah,
and so that'll be
definitely.
good. All right, Taylor, I want to give you, I guess, the final word on your particular candidacy for a board position. Give you the final word to have a say what you want to say about that, and why people should vote for somebody in your position.
Yeah, I guess the biggest thing is my passion for healthcare and pain management, and wanting the best for anybody, general public wise, already a patient of an osteopath, to get the best treatment and management. So really advocating for osteopathy and its benefits. There's definitely a drive there for that to be more well known. Had a lot of patients come in and be like, oh, I was told to come see you, but I'm not entirely sure what you do. So really wanting to engage the public with what we can do as osteopaths, and I like to think that I'm a keen people person. So,
Hmm.
bringing that communication and rapport, and really advocating for individuals, and what they want as best as I possibly can.
Yeah, fantastic. All right.
Yeah.
Well, I want to thank you for being with me tonight. However, I mean, I'd like to speak to all the candidates, but you've been one of a few that have actually put their hand up and I guess had the courage to come on and have a chat to me about your particular position. So thank you for that. However, this election goes, I want to commend you for putting your hand up and I guess wanting to take time out of your life to represent osteopaths. So thank you for that.
Yeah.
And like I said, whichever way the election goes, if it goes your way, we hope that you, I guess, put your best foot forward. If you get elected, we want you to have a loud and proud voice on the board and really advocate for your positions and try to get as much done as you can. We want people on there that will get things done, not just be there for the experience.
Yeah, that's definitely my aim.
Yeah, so we
Yeah.
hope that happens if you do get elected. If you don't get elected, keep going, like keep doing that, like keep soldiering on and try again. So definitely, I'm supporter of you, Taylor, in terms of what you're doing, and yeah, kudos to you. So thank you for being with me tonight. Everyone, that'll be the end of the podcast for this particular session. I want to thank Tayla for joining me. Taylor, stand along with me, but for everyone else, have a good evening.